Hi guys. So there is this misconception I want to correct out there, because I bumped into a lady yesterday. When I say I bumped into a lady, I watched a video and the lady was saying that he came to Germany. Somebody told her that if she go and do Pflege, her first year they will pay her 2,500 euro. And she said she's from Spain. I say, like, what? Now, I'm going to break it down for you what Pflege is all about in Germany. We have different type of Pflege. Now, we have Alter Pflege. As the name already said, old people. That is old people nursing. That is nursing that work in a care home. They take care of old people. And then we have Pflegehilfe. Pflegehilfe is nursing assistant. And then we have the main nursing, which is registered nurse. Now, the lady said that she doesn't want to work. Must she work as a nurse, changing pampers, See, I want to set this record straight. Nursing is not all about changing pampers. Depend on the one you choose. Because you can be a nurse, a registered nurse. You can study registered nurse. And then at the end, you might work all your life without changing pampers. Depend on what you want to do. Now, if you go for Alter Pflege, which is care home nurse that care for old people, that one you are limited. What you can do is you can only work in a care home. But when you go for the main nurse, which is registered nurse, it's a very broad sector. You can do a lot of things. You can work your life, the whole of your life, without changing paper. So I want somebody to come to Germany and start talking down. So I wouldn't want a place where you talk down on nursing in Germany, because to study nurse in Germany in Dutch language, it's not a child play. I've been there. The language alone is very difficult. You will learn day and night just to pass the final exam. And when you're done as nursing, you can decide to further your education, because nursing is a very broad sector, like I said. You can decide to go for ICU if you study more, and then you start working in ICU. You can decide to work as a scrub nurse, or some people call it surgical nurse or theater nurse. Yes. So I wouldn't want someone to reduce nursing to just changing pampers in Germany. No, that's where you get it wrong. And if somebody tell you that when you study nursing, you will be earning 2,500 euro in your first year of studying, and you believe that person haba now, you said, can't you do a research? Google it yourself. Even in your third year self, they don't pay you 2,500 euro. Who tell you that? Before you go to choose a profession, nursing is a profession, just like medical doctor, lawyers, or that. So I wouldn't want someone to come here and start talking down on profession like nursing, knowing fully well how difficult it is. So if you don't like any profession, go for the one you like. Not come on social media and start talking down on one profession as if it's all about changing pampers alone. No. It's not all about changing pampers. There are people that are studying nursing in Germany, they didn't change pampers. So like I said, there are people that study nursing in Germany that they work all their life without changing pampers. Depending on where you choose to work, depending on what you choose to study. Like I said, nursing is wide. You can, except maybe you went for Pflegehilfe, which is assistant nurse, or maybe you go for Alter Pflege, and those are limited. The chances of, work is limited. But when you go for the main nurse, which is the nursing, the registered nursing sector, you have a lot of chances. You can further your education to something else. A lot. You can work, earn good money without you changing pampers. So I wouldn't want someone to just come here and reduce nursing to changing papers alone. This misconception that nursing in Germany changing pampers. Yeah, when you're changing pampers, that means you work in old people, in a care home where they take care of old people. Yes, that's it. But that doesn't mean that nursing, the whole nursing, is limited to that point. And another point is that if you don't want to work in a care home and you want to earn big money, there are things like IT. Go for other professions that pay well. But for you to think that you come and study nursing and start earning 2,500 euro for the first month, how about now? Why not do research? Go and do practical. They call it practicum in Germany. Before I started my nursing school, I did practical in different companies just to choose before I choose my profession. Don't just choose profession based on the amount they earn or something. What if you don't like the job? So what if you don't like the job? Every day you go to work with headache, and no, go and do practicum in Germany before you start any profession, or to study anything. Don't just go because of the money.